Hi, this is Monica, and as part of my Healthcare Systems Leadership Doctorate in Nursing Practice degree program, I was tasked with developing an intervention for my practicum. I discussed potential topics with the President and Vice President of Nursing, and concussion care, collaboration, and education was identified as a topic. I met with PT Manager Ryan as a point of contact for the athletic training contract with the school, as well as with the athletic director and coaches for the school to get their insights. Please note that this is more of a tool that probably will not change our practice, but rather inform our practice as we continue to take excellent care of our patients. So the rationale for the algorithm isn't so much that it changes anything that we're currently doing, rather that it provides insights into the processes that occur on the school end after a student is seen. This will help us to provide a visual for impact testing for awareness and clearance if PT is unavailable. We all understand that major changes in how we manage concussion patients, which the CDC are actually calling minor traumatic brain injury patients now, have been occurring for more than a decade. And so that's not really the focus of the project. To explain the importance, I think this has been well publicized that we want to avoid those secondary and tertiary injuries if somebody already has a concussion. This will hopefully provide for consistent messaging to students and parents so that they understand that medically cleared does not necessarily equal cleared to compete. Ensuring that evidence-based processes are documented can help us reduce liability for providers in the facility, and it just helps us to support the long-standing relationship that was initially established by the athletic training contract between the hospital and Oaks Public Schools. This slide plays through the algorithm that I completed and gives just kind of an overview of each possibility and hopefully captures most of what you would see coming in. Hard copies are going to be provided to the ED and to the clinic. So if the patient is an Oaks Public School athlete, we're going to look at how far out are they from the injury. If they are over 24 hours from the injury and they don't have symptoms, we can figure out if they have symptoms with activity. If they do, then they still need to be reassessed in 24 hours. If the symptoms don't come back with activity, they can retake the impact screening. If they're below their baseline, again, they get reassessed in 24 hours. If they're at or above their baseline, they can return to light activity. And at each stage, we continue to monitor for symptoms. If they return, they're reassessed again in 24 hours. And that is consistent throughout the process, that if symptoms return or the baseline isn't met, then they're needing to be reassessed again. If it's not been 24 hours when they come in or they're still having symptoms, then they again need to be reassessed in 24 hours. If they come in and they're not an Oaks Public School athlete, but they are at a different district, we do want to encourage them to follow up with their coach or athletic director at their school upon discharge. If they're not a student athlete, we follow our usual protocol. Again, I will post this as a resource, but I don't think it really changes what we've been doing. Typically, Ryan or Amber will attend practices to assess symptoms, heart rate, etc., and determine if they are ready, if they needed that 24-hour clearance again. The impact test is a validated tool that can help to determine status of the student. They take a baseline test at the beginning of every season, and then if they do have an injury and once their symptoms are resolved, they do take the post-injury impact. They can sandbag some areas according to research, but the reaction time aspect, which they call a section or a phase of the test, typically is the most difficult to do that with. So that's a really good one to focus on if there are some questions or concerns about them maybe trying to defeat the test. You can see that the 6 phases include verbal and visual memory, visual motor, reaction time, impulse control, and then the students report their symptoms. Now, granted, when they're taking this, they shouldn't be having symptoms because they wouldn't have most likely been cleared to take it. But obviously they're reporting, and so perhaps they have said they didn't have any symptoms and, you know, they developed them as they're testing, or some other reason they are reporting them. So that's something to factor in too. This is just an example primarily of the visual memory questions on the impact test that a student would see. Once they take this test with the symptoms resolved, the healthcare provider has to compare the baseline and the reassessment, and they must meet or exceed that baseline composite. The section scores can vary by a few points. You know, perhaps their verbal memory is a little lower than it was before, but their visual motor is better, and so the baseline composite meets that to clear it. But the school does not just look at that score and clear athletes. Their provider does need to review it. This is an example of the numeric aspect of the scoring from a baseline to a post-injury exam. Any provider can interpret this if PT isn't available, but also note that these really should only be received for our patients. Sanford patients are being cleared by Sanford providers since this is, post and kind of outside of the athletic training piece because they're now, defined as having an injury and are in somebody's care. You can see on this exam that the student did report symptoms, and typically they're going to be symptom-free if they're taking this, but just so that you can see that for this one. Also, this came from the school, and she did note that scores in bold red are exceeding the reliable change index, and so she highlighted that drop in the verbal memory composite may not be a reliable score. Either way, this student would not have been cleared. As you can see, she did report symptoms, but also in most areas she did drop. Her memory composite, verbal and visual were both lower. Reaction time was lower. Impulse control and visual motor were higher. But the composite score then was too low, of course, to clear her at this point. So the outcome I'm hoping for here is just to back up the amazing care that we already provide to athletes and ensure that they're not confused about their ability to return to competition. So we're providing that consistent message. Parents and athletes receive this message from coaches and the AD at preseason meetings, but it's really a cooperative effort to reinforce this. And of course, this is a platform for me to gather data from pre and post intervention to complete my project. If you do have any questions or concerns about the accuracy or use of the algorithm provided or on clearing an athlete specifically based on those impact results between now and the end of February, you can definitely reach out to me. I can reach out to Ryan or Sherry if I need more information. After the intervention timeframe, Ryan remains your first point of contact for Oaks Community Hospital. Sherry is the point of contact for the school, but also note that that may change as they're hiring for an AD. And just know that the coaches and superintendent and principals as well are very well versed in the impact protocol that they use. These are my references for validation of impact as a tool, those sandbagging stats, information about sideline assessments, and I definitely have many more resources I've found in working through this project and practicum proposal. If you do have a concussion interest and want to reach out to me or just curious what there is in the literature or any more detail, I'm certainly happy to take those calls or emails as well. Thank you very much for paying attention to my presentation, and I look forward to any questions you may have.